Hi everyone, my name is Melanie Grant, and this is C&M Glass. This is our second video for our Coding with Miss Melanie Coding Clinic Review segment for our coding clinic that was held on April 2nd, 2019. And right now we're focusing on our 2030 classroom specifics. We've already focused in our first video on questions with assignments and deadlines, our coding project and final exam, as well as some information about attending coding clinic. So, our key points today are going to be some of the specific coding questions that were brought up during coding clinic on our last coding clinic session, where we'll be looking at those together, and I'll give you a couple of feedback on some of the issues that we encountered. So, most of our questions this week were in our workbook. Our workbook is for our medical coding workbook on sections for digestive in pages 109 through 110 and respiratory pages 101 and 102. We did look at our case studies this week for 11A and 11B and some questions about coding structure, especially when the difference between entering workbook questions and entering it for software. And last but not least, one of our Connect questions that wasn't entirely clear and left some students with incorrect answers. So let's get started with workbook question number 11 in our digestive system. I'm going to turn to page 110 to pull up this question. Okay, so question for digestive system 110 is a phrenotomy. In the back of your coding book, the issue with this is that there's actually two different types, and therefore this could have been two different answers. In the information that's given, it's not very specific, and so if you gave one or the other, it will be accepted. Looking at phrenotomy, I can find that in the back of my CPT code book on page 898 in the 2018 professional edition from the AMA. In the back of here, I find phrenotomy for both lip or tongue, and it lists for me codes either 40806 or 41010. Now, in the instance that you have something of this nature where you're unable to determine, of course you would have the actual procedure note in front of you so you could identify where was this procedure performed. In our workbook, it gives us code 41010 as the correct answer. But because it doesn't specify a location for this procedure, either will be accepted. Our next one is on question 15, a percutaneous placement of a gastrotomy tube with radiological S&I, meaning supervision and interpretation. We can start on this one by looking up exactly what we're doing. We're placing or inserting a gastrotomy tube. And so I would either start with the term placement, insertion, or even just tube or gastrotomy tube. Keep in mind there's a lot of ways to get to where you're going in your code book, and so you can go to any of these. Now, when we get there, there's a lot of different options, and so I'm going to go ahead and pull that up for us real quick. When I get to tube gastrotomy, it does say see gastrotomy tube. So it is going to be one of those redirects for me because I started with the word tube. As I mentioned before, there's a lot of ways to get to where you're going. Sometimes you can walk and sometimes you can take an airplane, but one way or the other, we will get to the same place. Okay, so I'm looking up gastrotomy tube. And as always, I'm singing my alphabet in my head. Okay. Okay, and I found this on page 901, gastrostomy tube, and I have the options of the different types of procedures, either change, contrast injection, conversion, obstructive, replacement, or repositioning. Now I want placement. And I have the options here of codes for placement under obstructive material removal. I have the placement for endoscopic or percutaneous. And I have codes 43246 and 49440. I'm writing both of these down because the code for question number 16 is going to be endoscopic of the same procedure, whereas question number 15 is percutaneous. And so if I look at the back here, I can see endoscopic is listed as 43246 and percutaneous is 49440. Now, however, I do need to look this up in my actual code book, so I'm going to pull those codes up and go to this section. And the first one, I always like to go in numeric order when I can, unless I skip to the back part for some reason. These are just techniques as a coder that you'll get used to when you're flipping between pages. So when I get to 43246, I notice first and foremost this is an indented code. And before I look any further, I want to make sure I'm in the right code section and on the right code. So I need to look up until I find the standalone code, which is actually going to be on a previous 2 pages on 291. The beginning of this standalone code starts at 43235 and identifies it automatically as an endoscopic procedure. I can see this by reading esophagogastroduodenoscopy as the first part of flexible transoral as the first part of the code before the semicolon. So I already know this is a scope, and then with directed placement of percutaneous gastrotomy tube. So if you were looking at 43246 as your code answer for question number 15, that would be incorrect because this is percutaneous placement through an endoscope. And it wasn't stated as that in question number 15. If you look at code 43246 before moving on, you'll also see several codes not to report it in conjunction with, as well as for non-endoscopic percutaneous placement of a gastrotomy tube, use 49440. So this right here is telling us for question number 15, where it's non-endoscopic, to look at code 49440. And I'm going to look there now. I'm also going to tag this because I want to come back to it when I look at my endoscopic procedure. So I'm going to flip to 49440. And I find this on page 332 under the subsection initial placement. It also tells me when not to report additional codes for 43752, which is not part of what I'm listing, so I keep going. Looking at 49440, insertion of a gastrotomy tube, percutaneous under fluoroscopic guidance, including contrast injections, image documentation, and report. This is the correct code because we did have radiological supervision and interpretation, which is that report, and it is indicated in this procedure here. So for question number 15, 49440 is the correct answer. This is one reason it's very important that we read all of the guidelines up and down, because that's going to help us identify exactly what code we need to use instead of getting in the wrong section and reporting the incorrect procedure. Now, when we look at question number 16, we can go right back to where we were, recalling that the actual tube we were placing in question 16 is endoscopic. And when we go here, we can see that that's exactly what's being done on 43246. When we go in here and we look at the original procedures, esophagogastroduodenoscopy, flexible transoral, and we can read through all of the indented options to make sure that there's not one that's more appropriate. And I'll give you the opportunity to look through page 292 at all of the answers here until you get to 293 at 43246. Now 43246, once you read through this, you'll see is the only one that includes the placement of a gastrotomy tube. And so for this reason, this is the correct code because it includes that. You will notice that it does not indicate the radiology. However, in the bottom of the code, it does say for replacement of a gastrotomy tube without imaging or endoscopy, use 43760. And so it is giving us guidelines on what to use without the radiology. So in this case, 43246 is actually the answer for question number 16. Okay, and this one was or. Okay, so question number 17 was the next one that came up. This one was a procedure, indication when two procedures are being done, and not to forget those modifiers as we're listing them. So for 17, we have a simple ileostomy revision done during the same operative session as a pharyngeal wound suture. What codes do we use, and is there a modifier? The first thing you should identify is that there's two things being done here. If you're not familiar with all the terminology that's being listed, make sure you Google the definition or pull them up in your medical dictionary to identify exactly what are these two different procedures and whether or not this is part of one procedure and that's just details, or if these are two separate procedures. You also want to determine if the information given here would indicate if these two procedures are related to each other. Once you do that, you should note that these are two separate procedures for ileostomy revision as well as a pharyngeal wound suture or repair. And so, in this case, your primary procedure will be the ileostomy revision and should be the first one you look up. We'll start by looking up revision in the back of our index. I'm going to put a pin in under repair where I know I'm going to go to next. Okay. When I get to revision in page 998 of my CPT code book, I see ileostomy revision, see ileostomy first. So it wants me to go to the location. So I'm going to go to ileostomy. Again, there's many ways to get to where you're going in the code book. Some people can even go directly into the table of contents for each code section and find that it's easier to get to the code they want that way. There's no wrong way to get there so long as you verify your code in the actual tabular section. Okay, so I'm just double checking my spelling. And I get to ileostomy revision on page 918, shows codes 44312 through 44314. Okay, I always write these down when there's multiple codes because it's going to help me in identifying the correct code by making sure I look at all of the options that were available to me in the back of the book. Okay, so I'm going to be turning over to page 307, and the first thing I'll notice, 443112 and 44314 are both under intraostomies, external fistulization of intestines. This is the subsection within this section, and I always look at that first because I want to make sure there's no in-section guidelines or indications I'm in the wrong section. I have the differences here. Revision of an ileostomy, release of superficial scar as a separate procedure, or complicated as reconstruction. In this case, it doesn't tell me the difference between the two as far as guidelines, and if I remember, it says simple here. So the code I should be listing first is 44312. There is no 313, so those are all the codes for that. Now, the second part that was being done is the repair, the suture repair being done to the pharyngeal wound. So anytime you have the term wound or suture, you know that we're doing a repair of an injury or a wound. So when I go here, keep in mind, most sutures that we think of are to the skin. And previously, we've always said when you're doing the suture, make sure you look for repair of the skin, not repair of the location. In this case, it did not say the skin, nor would it, since it's going to be to the pharynx. So I'm going to look for repair of the pharyngeal. And I'm looking on page 995 that I put a pin in earlier in order to find my code. I see here code 42953. Which indicates pharynx with esophagus. I'm going to look at the definition and make sure that it's not specifying specific areas, but that should be my correct code. So I'm going to look now in my digestive system to find that code. (42953) is going to be under the repair section. Now, one thing I want to point out, and this is one of the reasons I always read up and down, pharyngeoesophageal repair is not the correct code. We didn't have anything indicating the esophagus, but the code I found in the back of the book directed me to this. However, it's important to always read up and down in your code book. So if I read up, there's only 3 codes in this subsection for repair, and I can see that the very first one, 42900, is suture pharynx for wound or injury. In that case, I'm going to override what I found in the back of the book and use 42900 as it's more appropriate. Now keep in mind, I've just identified 2 procedures, or what's known as multiple procedures. And so the question that remains is, are these multiple procedures related, which would get a modifier 51, or are they unrelated multiple procedures, which would get a modifier 59? Without full detail of the information of the code itself, it would be hard to really say if it should be 51 or 59, but because of the location and the separate documentation indicated, it's done during the same operative session, but not related. And since these 2 procedures would not typically be related, I chose modifier 59 to say an unrelated procedure. Now, in the instance that one of them was caused by the other, there may be a question as to whether or not that was related, and that would be something that you would look at your documentation to fully determine. Okay, so our last 2 codes with our workbook are in respiratory section, pages 102 and 101. And we'll actually be on page 102 for questions 18 and 20. For our first one here, we have a direct diagnostic laryngeoscope and tracheoscopy with operating microscope. Okay, so I'm going to look in the back of my book under laryngeoscopy, since that's the first part that's being indicated. Now, this could be 1 or 2 codes, depending on what's included. And you want to remember that an operating microscope does have a separate procedure when it's not included in the main procedure that you're coding. So we want to look for both of those things. Okay, laryngeoscopy. I have direct, flexible, indirect, insertion, newborn, rigid, and with additional information. Now I'm going to look at this and see that it is a direct. So I'm in the direct diagnostic, and I have codes, let's see here, 31525 and 31526. Okay, so I want to look at those now. Now I'm in the respiratory system. When I get to 31525, which is the first one, I see that this is diagnostic except newborn, and it's indented. So I want to look and find the original indentation for the standalone code, and I also notice that there is some coding guidelines. So first and foremost, I'm going to look at 31505 and see that this full definition is laryngoscopy indirect. I'm sorry, 31525 is from the indented code 31515, laryngoscopy direct with or without tracheoscopy. So that right there tells me that yes, 31525 and 26 are correct to be in the correct section because it includes the tracheoscopy, which means there will not be a separate code for that. With or without means it doesn't have to include it, but it can. I also want to glance at my notes under endoscopy above that. I'm on page 184, by the way, for those of you that are in the same book as me. And I'm just looking at the information that it's telling me regarding endoscopic procedures and how it's coded based off of the anatomic site examined. So going back to my options, I have 31525, diagnostic except newborn. Presumably it's not a newborn, they didn't tell us. But if I look at 31526, this is partially why we always look at all our options. I have diagnostic with operating microscope or telescope. And it also indicates do not report 31526 in conjunction with 69990. So verifying that, 31526 is correct, and it includes all parts of this procedure. We have the laryngoscopy, the tracheoscopy, and the operating microscope all included in that procedure description. All right, so our last one from our workbook that we wanted to review for today is question number 20. Turbinate excision followed by an intranasal antrotomy. There we go, if I can say that correctly. Okay, so the first one we want to look up is the intranasal antrotomy. The reason why I looked that one up first is because the excision is following that, and I want to make sure that it would presume to be the primary procedure, and we want to make sure also if it includes any additional code also notes. So that's why I chose that. Which order you choose is not necessarily wrong or right. There is no wrong or right way to get there so long as you look at everything involved. Okay, and I'm verifying my spelling here, A-N-T-R-O. There's a certain point of the day that I refer to as 7 o'clock. It's not always 7 p.m., but it's when your numbers and letters start to blend together and you can no longer read or remember how to spell alphabetically. At that point is when you should stop coding and take a break. If you're in a job and you can't take an actual break, you should take you should take at least some sort of stretch break, if nothing else. Okay, so antrotomy. I find this on page 828, and it's an intranasal. And what I have here is I have antrotomy of sinus, maxillary, and several codes listed versus transmastoid. In this case, it is going to be sinus maxillary because that's one of your intranasal sinuses. And so I have a few codes to write down. I have here 31020, 31030, and 31032. Okay, so I want to make sure I look up all of those. I'm also looking in the back of my book while I'm here for turbinate excision, which I look under turbinate, and I find on page 1025, and it gives me listed codes 30130 through 30140. So I just decided to pull those both up before I go flipping through to look at these. And you don't necessarily have to pull them both up. I just wanted to make sure to look at both. So I'm going to start here. Again, I like to start numerically what comes first because I tend to use my tabs on my book, and those tabs take me to the beginning of the section. So I'll actually start with these first sections here, 30130, which is found on the page 179, excision, inferior turbinate, partial or complete, any method, and 30140, subcutaneous resection of inferior turbinate, partial or complete, any method. In this case, it was an excision, not a resection. Partial or complete and any method means that there's no different code for how it was done, so we don't need that detail necessarily. I also want to look at all the options underneath for excision of superior or middle turbinate, for example. It gives me information. It did not tell me which one, but it does have code 30999. So that would be something I would want to glance at as well. And that is just unlisted procedure. In this case, we're going to list the inferior, and this would be something you would verify, but we'll list 30130 for that code. And always make sure you verify if you don't have that detail from the actual note. In something like this in your workbook, if you have questions and something doesn't seem to tell you, make a note of it in your workbook answers to me, because it's something I will look at when I'm grading, and I will answer and or consider in giving you the correct answer. Now the other one we have is 31020, 30, and 32. So I'm going to look at that now, which is part of our accessory sinuses. 31020, sinusotomy, maxillary or enterotomy, intranasal, versus 30, which is radical, and 31032, which is also radical. So neither of these were radical. So we're going to list 31020, and that should be our primary code here. So we have 31020 and 30130. And now we're going to ask the question of what modifier do we list, because this is not a modifier 51 exempt code nor an add-on code. And so we want to make sure we list that correctly for multiple procedures. In this case, this would be related to each other based off the location of the two procedures being done. And so unless it's stated as separately identifiable, we're going to list modifier 51 for that secondary procedure. Okay, so that was it. Those were our questions on our workbook. We did do our discussion for our case studies, which is now available in the discussion post. Make sure you take a look at that and let me know if you have any questions on either 11A or 11B. You should find those to be fairly simple, but I know there were a few of you that had different answers, so I want to make sure you all take a chance to look at those. The last thing I wanted to talk to you about is the last two things is the coding structure and questions on Connect question number 6. So let's look at that one first. Okay, so we have Connect question number 6, which is going to be, I'm trying to pull it up on my device here. And I'm going to sneeze. Excuse me. Okay, question number 6. We're going to be looking at a, let's see, digestive question here, Give me 1 second to pull it up. My computer logged me out. And so while I'm pulling this up, just a little brief information. In our Connect, we've had quite a few issues where students are reporting repeat questions. This was due to an error on Connect's side where they had the questions listed for each portion of Chapter 25 identified separately, and some of them were repeating and incorrect. This week and next week, you should notice a significant reduction in the amount of questions that you have, as well as very specific to the parts of the chapter we're focused on. Now, if you have previous sections for 25 that you have not completed because it did seem like it was repeat, you still need to go back and complete those, as these are pulled from a list of questions and may have different information. For those that are repeat questions, you should have the answers, and that should give you an opportunity for extra points. So make sure you do that before the end of next week. So here I'm going to respiratory and digestive systems. In our chapter 25.7 and 25.9 homework. Question number 6. Okay, so this one has here, patient Colleen Masuki, a morbidly obese 27-year-old female, was admitted for gastric restrictive procedure. In addition to the gastric bypass performed by Dr. Lafferty, Colleen's small intestine was reconstructed to limit absorption. Okay, and so they want us to identify the code. Now we had the question that there were 2 possible codes for this procedure. The code that is listed as correct by Connect is going to be 43847, which reads to us as gastric restrictive procedure with gastric bypass for morbid obesity with small intestine reconstruction to limit absorption. And I read that at 43847 on the middle of page 302 in my book, which is an indented code, so I look at 43846 for that full code description. The code that it was being compared to is on page 300 for code number 43645. And this one reads as laparoscopic surgical gastric restrictive procedure with gastric bypass and small intestine reconstruction to limit absorption. So you'll notice that the 2 code descriptions are very similar, and the question was, what are the differences between these 2 codes, and how do we know that code for code number 43847 is the correct code, which is this code here? Okay, so I have 2 answers to that. Number 1 is, what is the difference between these 2 codes? If you look at the subsection that these are under, you'll find that code 43847 is under the section of other procedures, whereas code 43645 is under the subsection for laparoscopic procedures. Now, the first and foremost to identify is to say that if it's not documented, it didn't happen. And so if they didn't tell us it was laparoscopic, we would typically say it's not. And that's one of the ways we could look at the main golden rule of coding. But keep in mind, you'll never code off of just a brief description like this. You'll have more detail than what they're giving you. That being said, I do feel that they should have specified to us whether or not it was laparoscopic or an open procedure, as 43846, without stating that it was laparoscopic, would indicate to us that it's open, and it guides us to use of laparoscopic procedures 43644 and 43647 would be respective to that. So the fact that it directs us for a laparoscopic, use this other code, and the fact that it doesn't state laparoscopic would tell us that this is an open procedure, because we would have to get in there somehow. And typically open procedures do end up costing more. So we want that detail. We want the note to state how the procedure was done, what was the approach. In this scenario, they're only giving us a preview of the actual code in order to make it easier for students to see what they need to abstract. So the ultimate answer is that 43847 is giving us all of the correct information without additional details such as laparoscopic. However, I have submitted this to them and requested that they add the definition in their terminology to say that it was not laparoscopic or that it was open so that it can clarify for students. So when you find things like this, let me know. Send me a print screen of the question itself so I can identify it and review it for you. I know we're almost to the end of our term, so there's not a lot of these left, but if you have some from previous modules that you were still questioning on or didn't really understand the difference, feel free to send those to me. You can send me an email. Always give me at least 24 to 48 hours response time from the time I received the email, meaning that if you sent it to me at 6 o'clock at night, I will receive it the next day. And we do not count holidays or weekends in that. So if I receive it on Friday morning, for example, it may be Tuesday morning before I have a chance to respond to you. And please make sure that you understand email may take a little bit longer. I try to respond to students as quickly as I can, but sometimes there are several questions that come through or urgent issues with, as we've seen this module, some of the access to Connect or 3M or Blackboard not working properly. So I do put a lot of the focus on making sure everybody has access for those things. I try to read everything that comes through. If you have something more urgent, I encourage you to text me on my cell phone number. You can reach me anytime, day or night, and I typically respond either immediately or within the hour or a couple of hours from receiving that text message as soon as I have an opportunity. So that's all that we have for today. I hope that you enjoyed this segment of Coding with Ms. Melanie, and we'll see you very soon. Have a great day.